actually came from a relatively large family, and it seemed like we were always in the emergency room or hospital for one or more things, and had a lot of exposure at that time with medicine. And we had a very good physician when we were younger that took care of the whole family, named Dr. Bain. And he actually would let us listen to each other's hearts when we would go in for the exam with the stethoscope. When I got into high school, I had a biology teacher, Mrs. Thurston. She would have a really good ability to pick out particular characteristics that you had and try to improve upon them with her course in high school. And I remember one thing that she would do is that we had to study genetics. On the pre-test, she would actually put you as an example in the test. So she would say, Dr. Swanson comes into his laboratory and he sees that this is the mice with this particular trait and so forth. And she kind of tried to allow her to imagine what your life would be like if you were a doctor. And I think that impressed upon me the fact that, hey, I could probably do this. And so from that standpoint, from high school on, I decided that's what I wanted to go into. My desire to practice in Wichita Falls has actually been a 20-year process in the making. My wife, who's also a physician here in the group, Dr. Teswick, we met in medical school 20-some-odd years ago in Fort Worth, and I hit it off with her from the standpoint of just having things in common. And one of those things we had in common was my parents both met and got married in Wichita Falls over 40 years ago. And over the last 20 years, we've been back and forth to Wichita Falls a number of times when we practiced in Colorado and Florida and even in New York. We always find ourselves coming back here to Texas. So after about 18 years, 20 years of actually traveling the country and seeing how things were practiced in other places in the United States, we decided that most of our family now is in Wichita Falls, so we decided to move back to Wichita Falls. As a family practice practitioner, the idea that I've always kind of tried to live by is to be kind of the quarterback of the medical team. You have patients that come in with a variety of different medical conditions, all of which may require a specialist at one time or another. As a physician, as a primary care doctor, I look at myself as being that kind of a go-to conduit for a patient to make sure that the plan of care globally is being enacted in a correct fashion and there's no holes in the gap of the plan of care. So I find myself a lot of times calling the providers that they see specialist-wise and just kind of reiterating what the plan of care is with them and making sure that that's transmitted to the patient so they themselves don't have questions about what the plan of care will be. I look at my treatment plans and my treatment philosophy with patients to be more of a team player. I want to make sure I coordinate their care, but I also want them to be able to make educated decisions about what they would like to do. I don't ever feel myself or want to become a dictator to a patient. I've always wanted to be an advocate for a patient, but I want them to make the decision about what their health should be. It's their health. I'm just the person that kind of helps educate them about what the plans of care could be for a disease process or what things they should be doing to prevent disease in the first place. So I'm more of an educator and try to help and advocate for the patient's care that way. I don't want to become across as though they have no choice in the matter. They need to have choices. Here at the UPG Clinic, we actually have two nice arrangements with the laboratory and radiology services. We actually can do MRIs and CAT scans here along with regular X-ray. And it's been very helpful for our patients, especially because we have a walk-in clinic here that runs for most of the day, that they can actually go to the lab or X-ray on site without having to go to another location. But our patients in general love the ability to walk from one hallway to the next and get the blood tests and X-rays done. And we get back the results relatively quickly because of our integrated system for medical records. I'm an FAA aviation medical examiner. And I do Class 2 and Class 3 physicals for pilots in the area. I probably do between 50 or 60 a year, and I do it because I fly. I do a lot for the Shepherd Air Force Base officers that are going away to flight training in Colorado, so they'll come out and they'll have their flight physicals on before they leave. So for me, it's a nice tool that I use just for community service that seems to bring a lot of people joy, especially for the pilots in the area.